like to talk to you today about nutrition and health with a focus on blood pressure. High blood pressure is a very common problem that affects roughly 30% or so of adults in the United States. It's often defined as a blood pressure 140 on the top or higher, 90 or higher on the bottom, or individuals taking medication to lower their blood pressure. And again, that affects about 30% of adults, or about 70 million people in the United States. Another 70 million or so have something called prehypertension. It's blood pressure below the hypertension range, but not a normal blood pressure of less than 120 over 80. So these are blood pressures in the range of 120 to 139 systolic, which is the top number, and or 80 to 89 diastolic, which is the bottom number. But people with prehypertension are at high risk of developing high blood pressure in the future, and also their risk for things like heart attack and stroke is higher than individuals that have a normal blood pressure. Now again, medications are often used to treat high blood pressure, but nutrition is an important part of making the blood pressure medications more effective, particularly limiting salt. And also a healthy diet can reduce the number of medications that are needed to treat high blood pressure. In some people, lifestyle changes alone are adequate to control high blood pressure, and of course nutrition is a very important part of that. For individuals with prehypertension, for the most part, unless there are already complications such as heart disease or kidney disease or perhaps diabetes, the recommendation is for lifestyle changes alone, and again nutrition being a critical part. There's a lot of research on nutrition and blood pressure regulation. And for people with high blood pressure as well as prehypertension, a healthy diet is effective in lowering blood pressure. And in fact, in people with high blood pressure, dietary changes, even modest dietary changes, can have the impact of an individual or single blood pressure medication. Now, one of the most broadly studied nutritional patterns for treating high blood pressure was called the dietary approaches to stop hypertension. It's high in fruits, vegetables, whole grains, and low-fat dairy products. In these studies, the diets were not designed to reduce weight, nor were they really designed to dramatically reduce sodium intake. So despite no changes in weight and very little change in sodium compared to most usual diets, the blood pressure fell about 10 millimeters systolic for individuals with high blood pressure, and also a significant decline in those with prehypertension. So we do know that eating more whole foods, particularly fruits, vegetables, whole grains, and including low-fat dairy products, is an effective way to lower blood pressure. There are also other diets that are very effective for lowering the risk of cardiovascular disease, both in primary prevention, that is preventing the first heart attack or stroke, and also for secondary prevention, that is individuals that have already had a heart attack or stroke following a healthy diet, showing reduction in events. And I will say, for those of you that may have already suffered a heart attack, individuals that followed the Mediterranean diet had about a 70% lower risk of having a second heart attack when they followed a healthy diet, which is, say, the Mediterranean diet, which is also high in vegetables and monounsaturated fat or olive oil. And in this particular study, even though the diet itself did not dramatically improve cholesterol values, the reduction in heart disease was better than most of the studies where we've actually used cholesterol-lowering medication. So again, the notion that diet can be at least as effective as medication for lowering blood pressure, reducing risk for heart disease, is something that's perhaps not well known. Now, you will have links to some of the things we've talked about today, such as the DASH diet and the Mediterranean diet, to learn more about this. But I want to encourage you that lifestyle is a critical part of disease prevention, both primary prevention of the disease, that is the first events, as well as preventing recurrence if you've already had a heart attack or stroke. Moreover, a healthy diet is effective in reducing the development of risk factors such as high blood pressure, high cholesterol, and diabetes. Now again, if they're not completely successful, I would encourage you to continue that healthy dietary pattern, because fewer medications will be required to control your risk factors. And if you've already had an event, continue to take the prescribed medications, but recognizing that a healthy nutritional pattern will reduce your risk for additional serious events.
Thank you. Thank you, Dr. Egan.